Imagine that you can be able to explain what you feel or your pain. Imagine that you are invisible in space that means for healing. For millions in deaf and disabled communities, this is an everyday reality in the healthcare system. The purpose of this video is to explore how American Sign Language bridges communication gaps in the medical care, especially in physical therapy, for people with a range of disability and not just for deaf community. ASL is more than a language. For the deaf community, it represents identity, culture, and autonomy. Over 500,000 people in the US who are identified as deaf, cultural deaf. ASL is the primary mode of communication, but ASL using community is broader than many realize. ASL is used by people with autism, cerebral palsy, intellectual disability, or speech impairments who prefer this method of communication because offered a visual and accessible alternative to spoken language. What all of they share is that they need to be understood, and especially in the healthcare. Some examples of communication barriers are lack of certificate interpreters, overuse of lip reading and note passing, misdiagnosis due to miscommunication, and emotional stress and isolation. There are studies that show that only 30% of the spoken English can be accurately reading, and the people who English isn't their first language, only a few can understand the writing notes. What is the consequence? This can lead to serious medical errors, mistrust, and even legal consequences. When communication breakdowns, so does care. A 2025 review found that the deaf sign language users frequently report leaving the medical appointments without understanding about their condition or follow instructions. Many weren't sure how to take their prescribed medications or when to return to appointments. Only 41% of the patients report understanding medication instructions clearly. This lack of understanding can seriously impact the treatment adherence, especially in physical therapy, where following a routine is essential for the progress. A worse situation, many deaf individuals say that they must fight to get their interpreters. Without accessible care, patients avoid or delay appointments. This will be worse for their conditions, and it is not just like an inconvenience, it's like a systemic barrier that increases suffering and depends health inequalities. It shows that when interpreters are present in the sessions, deaf patients report higher satisfaction, better understanding, and increased adherence to treatment plans. Another benefits are accurate exchange of information, clear visual instructions for the exercise, higher engagement and confidence from the patient, a stronger relationship between the patients and physical therapists. So, accessible communication means better outcomes, less anxiety, and higher trust. But how do we move from awareness to action? Some actions that physical therapy can make is to learn basic ASL language relevant to the field, always request certificate interpreters, use visual and accessible formats, and seek disability inclusions and ASL training. Some actions taken from institutions are to create policies that ensures interpreter access, train the staff in ASL awareness and disability inclusions, and partner with deaf and disability advocates. Patients and family also has a role. Knowing your rights, asking for what you need, and speaking up for the inclusive care, it is important and make change. These are is clear. When communication fails, the care fails. But when we meet patient linguistical and culturally, health outcomes improve and life change for them. Also, by recognizing ASL as a communication tool for the diverse individuals, we are taking a step towards dignity, equality, and a better health for all. So communication is not optional, it is essential.